Guide to the graphic. Here we have a presentation of the leg with the bones, muscles, and knee exposed. Here in purple we have the patella surrounded by inflammation. Here we have the upper leg. In lemon is the femur, the large bone of the upper leg, surrounded by muscle. In raspberry, we have the anterior cruciate ligament, or ACL. And here in lemon, we have the tibia, one of the bones of the lower leg. Clinical presentation of osteoarthritis. In the United States, both sexes tend to be affected equally. Potential risk factors include obesity, repetitive use through work or leisure activities, and heredity. The clinical presentation depends on the duration of disease, joints affected, and severity of joint involvement. The predominant symptom is a localized, deep, aching pain associated with the affected joint. Early in the course of the disease, pain occurs when the joint is first used and becomes relieved by rest or removal of weight from the affected joint. Later, the pain occurs with minimal motion or activity and may be present even during rest. The joints most commonly affected are the distal and proximal interphalangeal DIP and PIP joints of the hand, the first carpometacarpal CMC joint, knees, hips, cervical, and lumbar spine, and the first metatarsophalangeal MTP joint of the toe. In addition to pain in the affected joint, limitation of motion, stiffness, crepitus, and deformities may be present. A sense of weakness or instability may be associated with this limitation of motion in patients with lower extremity involvement. The joint stiffness lasts less than 30 minutes and often occurs after sitting or resting for some time. Joint enlargement typically is related to bony proliferation or, in some cases, thickening of the synovium and joint capsule. The presence of a warm, red, tender joint may suggest an inflammatory synovitis. Joint deformity may be present in the later stages and is the result of subluxation, collapse of subchondral bone, formation of bone cysts, or bony overgrowth. Physical examination of the affected joint or joints reveals pain, tenderness, crepitus, and possible joint enlargement. And that's the clinical presentation of osteoarthritis. Have a great day.